So a couple of days ago, my social media was blowing up when the story from the World Health Organization came out about asymptomatic spread being rare.
Right.
And then they followed that up with a correctional statement saying, well, it's unclear. But it directly contradicts what we've been saying for several months and then what the CDC is saying. So can you kind of explain that and what we are taking, what road we're taking on that?
So that's been the one constant throughout this pandemic is the conflicting information. Yeah, it's changing every day. I mean, I don't even know where we stand on hydroxychloroquine. It was totally dismissed, just a week and a half ago, and now people are going, wait, maybe that was premature, maybe it is a good thing after all. So yeah, it's frustrating for folks, and some of it is just to be expected. I mean, it's called a novel coronavirus, novel being new, unknown. People don't, so there's little that's known about it other than what we're learning in real time, and we're learning new things each and every day. We have some of the most brilliant scientists that are, working to find a vaccine, to find antivirals. So the information is going to be changing all the time. Our one constant is we have continuously followed the recommendations for the Centers of Disease Control. So the CDC, who generally tends to be more conservative, there's no doubt about it. They're going to err more on the side of caution. And oftentimes they do contradict the World Health Organization, WHO, which is one of their top experts at the World Health Organization, came out with that statement. The CDC said we do not agree with it, that our evidence shows that asymptomatic patients can absolutely pass the virus on to other people. The one thing that's been interesting, I think they both kind of agree on it, is that there's now a belief that contracting the virus from surfaces, like grocery bags, tables, chairs, things like that, is more rare. It definitely can happen. And that's why we're told, always wash your hands, after touching surfaces and so forth. But there's a belief now that it really is passed person to person, which is, symptomatic to symptomatic, or symptomatic to asymptomatic, or vice versa. So interesting that the World Health Organization person did kind of backtrack pretty quickly. No doubt about it, what a firestorm. I walked into the house and my wife says, honey, you don't have to wear your mask anymore. We're good, and I'm, whoa, where'd you hear that?
Yeah.
So I think there were probably a lot of our employees, when they heard it, they're, wow, this is incredible, game changer. And but then so quickly to come back and retract that and say, well, I was misunderstood. Again, you're going to get that constantly changing information. We haven't changed our position. We're still doing uniform masking. In fact, as more and more personal protective equipment becomes available, again, we're trying to exchange out even more rapidly with our employees, particularly those that are exposed. So.